this operation is the biggest operation we've had ever in Belgium. So the first area of intervention is in hospitals. So we took 2 areas of interventions here in the country, around Mons and around Antwerp. We're looking at the third one in Limburg because the needs are very high. We bring expertise on how to organize, how to work on infection control in these hospitals, looking at materials because everybody is short on materials. Can we reuse them? Are there ways that we can disinfect? Because we are an organization that always invents new ways because we have to adapt. So the second area of intervention, we know in this epidemic specifically, elderly are a vulnerable group. And especially what we see here in Belgium, and we see it in other countries, care cannot reach the homes anymore because the whole healthcare services are overloaded. So we set up a whole system to support these retirement homes to identify the patients, isolate, test, and organize care. Also, health promotion for the rest. Again, infection control in these homes is very important. So there we support them, and then mental health if needed. The third area of intervention, as everywhere, MSF looks at the most vulnerable people. In a country such as Belgium, it will be people who live in the streets. That can be homeless, migrants. Where are they? What can we do for them? They could be positive of COVID. So we've opened a structure for the moment with 50 beds that we can increase to 150 beds, where we will follow them medically. We have a lot of ongoing missions in 70 countries worldwide, and we are preparing our teams in Africa, in Latin America, in Asia, especially refugee populations, dense urban populations that don't have the means to wash regularly, to have social distancing, to quarantine themselves. Also, the healthcare structures are not at all prepared. How will our supplies reach them? Transport is more difficult, will be more costly. Airports are closing. So we are looking for solutions and mitigate and see how we can still prepare also worldwide our interventions for the virus that will continue to spread, we are certain.